Why is high blood pressure important to control for patients with heart disease? We hear this constantly, but tell us why it's important.
So Kathy, it's a great question. And a lot of patients will ask the same thing, is they don't necessarily feel anything, but high blood pressure over time can change the vasculature, and it changes the flow of the vessels to the heart, the brain, the kidneys, which can cause a lot of different problems over time. So high blood pressure is something that I try to manage very carefully, because it's something that over time can cause a lot of problems. So the goal is to get to patients as close to 120/80, as I mentioned before, whether it's with lifestyle changes, more exercise, weight loss, changing the salt in the diet, or with ultimately medications. We have to try to get patients to goal.
Now, does the challenge come in when a patient says, you know, I took my blood pressure, I'm fine, and then they feel, well, why do I need to check it again?
Right. Well, it's another great question, because this happens all the time, because they'll come to the doctor's office, they're nervous, they just had coffee because it's one of the first appointments of the day, and then they realize that my blood pressure is 140/90. They say, well, doc, my blood pressure at home is always better. I said, well, you know, it's a little bit high here, and maybe you're under stress, so we try to gauge how their blood pressure is doing with the blood pressure log. I will frequently ask them to check it, particularly in the morning, because that's when it's going to be highest. And we'll see what it is on a regular basis, as opposed to just one visit in the office. In fact, we really should be doing about 3 readings before we label the patients as having hypertension.
Wow. How is it managed once you're in cardiac rehab? How do they teach a patient to log their numbers?
So what we'll do in cardiac rehab is on their first assessment, they get their blood pressure checked. And on every time they come in, they get their blood pressure checked before exercise and then during exercise. Because with exercise, your blood pressure is going to go up.
Right.
The issue is that does it go up too high? Because if it's going up too high, maybe it's not as controlled as we think it is. So the goal is with exercise to make sure your blood pressures are checked in cardiac rehab, to make sure it doesn't go too high or get too elevated while you're exercising. So the exercise staff there and the exercise physiologists and nursing staff will kind of guide the patients on how to check their blood pressures at home, when to check them regularly, and it's also another way that they get checked on their 36 sessions.